Welcome to this comprehensive guide on diabetes mellitus, a chronic metabolic disorder affecting millions worldwide. In this episode, we'll break down the types of diabetes, what causes them, who's at risk, and how diabetes is diagnosed, managed, and most importantly, prevented. Diabetes mellitus is a chronic condition that occurs when the body either cannot produce enough insulin or cannot effectively use the insulin it produces. Insulin is a hormone made by the pancreas that allows sugar, or glucose, to enter cells to be used for energy. When this process fails, glucose builds up in the bloodstream, leading to high blood sugar levels, which over time can damage the heart, kidneys, nerves, eyes, and other organs. 1. Type 1 diabetes. An autoimmune condition where the immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. It typically appears in childhood or adolescence, but can occur at any age. Patients must take insulin daily for life. 2. Type 2 diabetes. The most common form, the body becomes resistant to insulin or the pancreas doesn't produce enough. It is largely lifestyle-related and often occurs in adults, though increasingly seen in younger people due to rising obesity. 3. Gestational diabetes. Develops during pregnancy in women who never had diabetes before. It usually goes away after delivery, but increases the risk of developing type 2 diabetes later in life. 4. Prediabetes. A warning stage where blood sugar levels are higher than normal but not high enough for a diabetes diagnosis. Without intervention, it often leads to type 2 diabetes. 5. Other specific types. Less common forms include MODY, maturity onset diabetes of the young, a genetic form. LADA, latent autoimmune diabetes in adults, shares features of type 1 and 2. Secondary diabetes, caused by medical conditions like pancreatitis or medication use like steroids. Causes vary by type but include type 1 autoimmune destruction, genetic predisposition. Type 2 insulin resistance, obesity, sedentary lifestyle. Gestational, hormonal changes during pregnancy that impair insulin action. Common risk factors. Family history of diabetes. Overweight or obesity. Physical inactivity. Poor diet high in refined sugars and fats. Age over 45. High blood pressure or cholesterol. Polycystic ovary syndrome, PCOS. History of gestational diabetes. Classic symptoms include frequent urination, polyuria. Excessive thirst, polydipsia. Unexplained weight loss. Extreme fatigue. Blurred vision. Slow healing wounds. Tingling or numbness in hands or feet. Recurrent infections, especially skin or urinary tract. In type 2 diabetes, symptoms may be mild or go unnoticed for years. Doctors diagnose diabetes using blood tests including fasting blood glucose test, greater or equal to 126 mg/dl indicates diabetes. Oral glucose tolerance test, OGTT, 2-hour reading greater or equal to 200 mg/dl. Hemoglobin A1C test measures average blood sugar over 3 months, greater or equal to 5% confirms diabetes. Random blood sugar test, greater or equal to 200 mg/dl with symptoms confirms diagnosis. Prediabetes is diagnosed with slightly lower levels on these tests. Type 1 diabetes treatments. Lifelong insulin therapy injections or insulin pump. Continuous glucose monitoring. Diet and exercise planning. Type 2 diabetes treatments. Lifestyle modifications, diet, physical activity, weight loss. Oral medications like metformin. Non-insulin injectables e.g. GLP-1 agonists. Insulin therapy if other treatments fail. Gestational diabetes treatment. Special pregnancy-friendly diet. Physical activity. Blood sugar monitoring. Insulin if necessary. Support from nutritionists, educators, and healthcare providers is key for successful management. While type 1 diabetes isn't currently preventable, type 2 and gestational diabetes can often be prevented or delayed through maintaining a healthy weight, engaging in regular physical activity, eating a balanced diet rich in fiber, whole grains, fruits, and vegetables, avoiding sugary drinks and processed foods, quitting smoking, regular blood sugar screening, especially if at risk. Even small lifestyle changes, like losing 5–10% of body weight, can significantly reduce diabetes risk. Diabetes is a serious but manageable condition. Early detection, consistent treatment, and healthy living are powerful tools to reduce complications and improve quality of life. If you suspect you have symptoms or are at risk, speak to a healthcare professional today. Stay informed, stay healthy. Thanks for watching to this educative video on diabetes. Don't forget to like, subscribe, and share this with anyone who could benefit. For more expert health content, stay tuned to RN Mujib channel.